Let us go to the topic at hand. I don't want to hog the time. We have chosen a very interesting topic, trash talk. Even they have even a nice byline, no? And very attractive byline, trash talk. So we're talking about dental waste management in the new normal. What we should know. Very interesting. And we have invited two resource speakers here. I'll introduce them later. They will be introduced later. Before I pass on the um, the page to before I pass it to someone else, to Dr. Rochelle, our UPDAA president, I'd like to mention and acknowledge the help of the people who were involved in this collaboration. So this was initiated by my Michelle, me, and Rochelle, UPDAA and ADI, and because we needed, you know, of course, also our resource speakers, Faye. And then the thing is, from there we were able to, we had to, we were able to collaborate with UP College of Dentistry. So we'd like to acknowledge the support of UP for making this meeting possible. And a lot of people worked before going. Like to mention the work or the contributory work of Dr. Jonathan Panjalan, UPDAA member, UPCD graduate, and ADI acting fellow. Rochelle Javier, our UPDAA president, who is also the secretary of ADI. See, we're wearing two hats and several hats here. Everybody is mostly involved. And also from UP College of Dentistry, Dr. Michael Mendoza, who is part of the community dentistry department, very much involved in this topic that we're going to have, and all the other support crew, no? From Dr. Mark Pilas, Monica Kiambao, Jody Guzman, and all the others I may not have mentioned because there's so many. And thank you so much for all your help to make this possible. I would like to pass on now the screen to our president, UPDAA president, and also our ADI secretary, the beauteous Dr. Rochelle Javier.
Good afternoon. Thank you to my ADI boss, fellow Armin Segarra. Today I also represent the UP Dental Alumni Association and our 11 other hardworking officers. We'd like to welcome the ADI fellows and active members, our UPCD faculty, and of course our beloved UP Dental alumni. We are glad that you are keeping safe in the comforts of your home so that you can actually join us. Just a few reminders for everybody else. Mute your mics and your video. And if you do already have questions, please put them in the chat box or in the comment section so that we can actually collate them. Number two, after the webinar, you will have to please help us by answering a survey that we will email to you. And we will also send the link to our UPDAA page or our Facebook page. And lastly, we would like to also thank Dr. Armin mentioned the technical committee. We would also like to mention Dr. Elch Barroso, Dr. Jamie De Vera, Dr. Mark Pilas, all of them working also under the technical direction of Dr. Jonathan Panjalan. Lastly, before I turn it over to Dr. Jeje, for those UP Dental alumni who are on Facebook, who are not yet members of the UPDAA, please join so that we can keep track and we can announce our projects and next webinars. So thank you and good afternoon. I'd like to turn you over to our collaborator, aside from ADI and UPDAA, the Queen of Community Dentistry of the UP College of Dentistry, Dr. Jeje Santos.
Thank you, Rochelle. Our esteemed speakers, Ms. Faye Ferrer and Dr. Michelle Segarra, the President of the University of the Philippines Dental Alumni Association, Dr. Rochelle Javier, the President of the Academy of Dentistry International Philippine Section, Dr. Armin Segarra, UPCD Faculty, officers, members, and fellows of UPDAA and ADI, fellow dentists, good afternoon. In behalf of the College of Dentistry of the University of the Philippines, Manila, and its executive committee headed by Dean Danilo Magtanong, I welcome you to this webinar, Trash Talk Dental Waste Disposal in the New Normal. We have been used to attending on-site continuing education seminars and conferences in person. However, the times have drastically changed. So, as we are gathered online today, we continue to learn even though we are at home. How should we go about the new normal in the practice of dentistry? We realize that we have to prepare ourselves not just with supplies of PPEs and new dental equipment, but also with the knowledge on how we should be managing the increase in the amount of dental waste which we will be generating for infection control. We are going to be productively busy in the days to come. Of course, there will be more online continuing education seminars coming up in the near future, and we look forward to seeing you again online. I would like to thank everyone for being here this afternoon for this first ever continuing education webinar offered by the tripartite of UPCD, UPDAA, and ADI Philippines section. Welcome, everyone.
Back to me. Is it back to me now?
Yes, Dr. Armin.
Okay, so without further ado, let me introduce our first speaker. She has a ton of credentials, but I will mention only the ones that are pertinent to her topic today. Our first speaker is Dr. Michelle. Our first speaker is Dr. Michelle Sunico Segara, DMD, MOH, and PhD. She is a vice president of the group Healthcare Without Harm, Southeast Asia, which is NGO, and an international group. And she's been a member of that outfit since 2008 up to the present. She's also a holder, a master of occupational health from UP College of Public Health, which she obtained in 2001. Aside from that, she's a professor of the UP College of Dentistry and a PhD holder from the Department of Cardiology and Operative Dentistry, Tokyo Medical and Dental University, in 2018. So, without further ado, to talk about our topic, Trash Talk, Dental Waste Management in the New Normal, please welcome Dr. Michelle Sunico Segara.
Hi, should I?
I can see you already. Go.
Good afternoon, everyone. Thank you very much for that introduction and for the great work that the people behind this activity have been doing. And they have been working hard for this webinar to push through. So my topic is, this is actually two topics. This webinar is actually composed of two topics. The first topics will be given by me, and topics about possible solutions to problems and laws and legislation will be tackled by my partner, Ms. Faye Ferrer. Faye and I have been working on healthcare waste disposal, first under the Healthcare Without Harm, and then under the Global Green and Healthy Hospitals initiative. And now we're turning our efforts into dental waste management, especially in the time of this COVID pandemic. So without further ado, I would like to start my lecture. I'm only given 30 minutes for this. As we all know, it has been seen in most publications that dentists, one is from the United States, They acknowledge that dentists are one of those who earn a lot of money, but also in the most dangerous job scale in terms of the COVID pandemic, we are also on top of the list because we were close to our patients. We are constantly exposed to aerosols and their saliva, and that prompted us to have more stringent infection control measures, paying more strict attention to the use of PPEs such as masks, respirators, face shields, gloves, surgical gowns, and what have you. And this is going to be the new norm. From now on, when we open our clinics after the ECQ, there will be a lot of changes in the way we practice our profession. For a while, I'll just mute my phone on my Facebook. Better? Is it better? Better now? Okay, sorry for that. And also, I've seen in Facebook, there's a lot of physical barriers being used. And most of these physical barriers are made of plastics. So we can push it to the point of absurdity like this. And does it make us safe? Does it make the environment safe? And while I was looking at all these Facebook posts, all these guidelines, CDC, ADI, ADA, etc., I kept thinking how much waste will be generated in the dental office in the new normal. Especially when this paper first came out in the Journal of Dental Research, there is this study from China that salivary glands were seen to be potential reservoirs for COVID-19 asymptomatic infection. That makes it scarier for us dentists. And so, with that in mind, we now think, or it's true, everything that enters the patient's mouth or was in contact with the patient's saliva is considered infectious and disposed of or treated as such. And pre-COVID, this was the situation. So Armin and I have been talking that if we practice strict infection control and waste disposal before COVID happened, we won't have much problem post-COVID or during the COVID pandemic. Okay? Now, I attended a Global Green and Healthy Hospitals webinar some time ago, maybe 2 weeks ago, and Dr. Jorge Emanuel, he's a microbiologist and is a consultant of the WHO and other agencies. He mentioned this, that SARS-CoV-2, the coronavirus responsible for COVID-19, is among the easiest pathogens to destroy. Having said that, then it is easy to disinfect our clinics. And it has been said over and over again in various webinars and bulletins that indeed soap and water can destroy the virus. Okay. Before I begin with the topic of segregation, this is from from the NGO I belong with, the Healthcare Waste Management, in a bulletin written by our president, former DOH Secretary, Dr. Esperanza Cabral, came out on March 24, 2020. There is a slightly different coding and classifying in infectious waste around the world. So if we surf the internet, it might be confusing because different countries will classify and code their waste differently. So in China, it's got this from the Wuhan situation. They have several bins for infectious waste, separating plastics, sharps, biodegradable infectious waste, etc. So for purposes of simplification, I am going to present to you the DOH Healthcare Waste Management Manual, which was written in 2015. And I don't know if it has been revised, but we are still using it today. and they classified healthcare waste as the following. I think we are all aware of this, but just as a brief review, for non-infectious waste, we have for the biodegradable, like the kitchen waste, the yellow, the green coded plastic bags. For bottles and cans, papers and cartons, they are recyclables and they are non-biodegradable. They are thrown in black bags and they are disposed of in the garbage area. For aerosols and pressurized containers, like now, we are fond of using the Lysol can spray. So we place them in red containers and place in suitable storage area. We store them first because we cannot just throw them away. Kailangan marami muna yan bago natin itapon. Otherwise, hindi maganda yung segregation. Okay? For infectious waste, of course, we all know this. They are placed in yellow bags with the international symbol for biohazards or biomedical waste, and they are again disposed in the garbage area. Chemical waste, still under the DOH Healthcare Waste Manual, they are placed in yellow bags, same as the infectious waste, and placed in a suitable storage area. Sharps will be placed in sharps containers and again stored in a suitable storage area. Expired pharmaceutical waste, the DOH, if you read the manual further, since we are small producers of pharmaceutical waste, they said for small amounts, we can actually place them together with the infectious waste. But for hospitals, that's different because they have a lot of pharmaceutical waste. For pathologic waste, again, it is recommended that we put them in yellow bags marked with the biologic hazard symbol. Now for hospitals, they recommend that it be disinfected and a storage area that is cool, that is refrigerated. But in the dental office setting, hindi naman ganun karami yung pathologic waste. So maybe we should just disinfect them and throw them together with the infectious waste or bagged separately. The dental office is also the source of hazardous waste like mercury from our dental amalgam, lead from our x-rays, and from our lead aprons, and used fixer solution. Used fixer solution is hazardous because it contains silver from the developing and fixing of our x-ray films. And so they should be also stored separately in suitable storage area, and they are for recycling if we find recyclers for them. Now the segregation should be at source. Therefore, there should be separate waste bins for each room. And the waste bins in the operatory where there's infectious waste should have lids or should be covered. There should be proper labeling. And for the convenience and education of the staff, there should be posters telling them what waste should go into this bin, how it should be disposed, etc., etc. Now, it is also recommended that for infectious waste, we write the date when they were generated. I will explain this to you later, why the need for that. Now, infectious waste containers should be pedal operated to open the lids, and they should have color-coded bags inside, and the lids should remain closed except when waste is discarded because these are infectious waste. Let's go to our PPEs. And our recommendation for us dentists is level 3. Some would prefer level 4. And with that, we all have these PPEs. We have the head cap, We have the surgical gown, the safety goggles or eye shields. We have the face shields, our respirator mask like the N95 or the KN95, surgical masks, gloves, and shoe covers. Sometimes you have two gloves. Some recommend the use or doing double gloving. So let's calculate our waste from PPEs alone. Let's take a solo practice with one receptionist, one assistant, one operator, and consider everything we use is disposable. Therefore, for one patient, we have one surgical mask and head cap for the receptionist. For the dentist and the dental assistant, each will have one surgical mask, a head cap, an N95, a pair of booties, two gloves each if they prefer double gloving, and an isolation gown. And for the patient, he will be wearing, we have to provide him a head cap and an isolation gown. So for one patient alone, everything that we use is disposable, so that's considered waste. We will have 3 surgical masks, 2 N95, four head caps, 2 pairs of booties, 2 to 4 pairs of gloves, 3 isolation gowns. If we treat 5 patients in a day, then you can do the math. And I did not do a good math here because 3 times 5 is 15. So there should only be 15 surgical masks, 20 head caps, 10 pairs of booties, 20 pairs of gloves, and 15 gowns. That would be increasing our waste burden or waste footprint not only 100-fold. Dadami talaga yung waste. And sad to say, most of these PPEs are non-biodegradable. That's why we have a lot of problems with plastic in healthcare. So, the Asian Development Bank came out with a bulletin sometime last March about managing infectious medical waste during the COVID-19 pandemic. And they focus on household infectious medical waste management because at that time, the PUIs and the PUMs were staying or being quarantined in their houses. And they recommended that to segregate all medical waste such as face masks, wipes, and tissues in yellow infectious bags, yellow bags for infectious waste, and they should be double bagged, swan neck tied like this one. I'll show you another graphics of how to do the swan neck tying, and the outside sprayed with 0.5% chlorine disinfectant solution or 1% household bleach solution. Now, if the situation is ideal, and there's a dedicated medical waste collection, then the double bag waste should be disposed of immediately. But I think in the Philippine setting, that is very difficult or almost next to impossible na araw-araw may mangungulekta ng basura. If no dedicated medical waste collection is available, then the double bag waste should be stored for 72 hours before being disposed with the general household waste. That's why I mentioned earlier that infectious waste should be dated. You should write when these wastes were generated, because studies have shown that the COVID virus lives outside the body. The COVID virus lives for at most 72 hours. So after 72 hours, they die. And they say we can dispose of them in general household waste or hindi na masyadong delikado sa mga waste collectors. Okay. As for sharps, they are placed in our sharps container. If we want to segregate it further into biodegradable and non-biodegradable waste, because our needles have these plastic caps, we can use a needle destroyer and separate the plastic component from the needle itself. So sharps include, in the dental clinic setting, include needles, carpules, scalpel blades, and aside from that, we have our burrs, endodontic files and reamers, and suture needles. So all of them should go into this kind of disposal bin. Again, with the international symbol for biomedical waste or biohazard. Now, this slide I borrowed from the presentation of Sister Arcelita Sarnilio during a webinar in last April 2020. This is what they're doing at St. Paul's Hospital of Iloilo. It's one of those hospitals that the Global Green and Healthy Hospital initiatives to be using best practices in their management of COVID waste. So they have separate containers for the head cap, gown, and the shoe cover. Another container for the used goggles, which will be later on disinfected and reused. And soiled linen, or our, what do you call it, surgical gowns, because they're using reusable gowns. Even for the sharps, they also segregated it, okay, because some of them are plastics. Malaki talaga yung concern ngayon sa plastics. Okay. What about our waste from infection control equipment, like our HEPA filters, yung filter ng HEPA filter natin, the waste from our high volume evacuation system, and the filters of our APRs and PAPRs. For the HEPA filters, they're usually changed every 3 to 4 months, depending on the volume of patients and the procedures that the dentist will be doing. They are considered infectious waste and should be placed in the yellow container because they filtered viruses and microorganisms, so they're infectious. You should handle them with care and then place in a sealed bag in the yellow container. Now, waste from intraoral high volume evacuators, you can dispose of them in the drain under running water. And then you should disinfect the sink with sodium hypochlorite. Now there have been questions about treatment of the wastewater. Do wastewater treatment plants kill COVID-19 viruses? The answer there is yes. Coronaviruses are susceptible to disinfectants, and standard water treatment will kill the virus. Another question is, can I get COVID-19 from sewage or wastewater? According to the WHO technical brief, Water Sanitation Hygiene and Waste Management for COVID-19, there is no evidence to date that COVID-19 virus has been transmitted via sewage systems with or without wastewater treatment. So it's safe. Our problem right now is that those non-biodegradable infectious waste, especially plastics. So we have a lot of plastic waste in our clinics, and most of them are from infection control. How do we deal with this problem? Plastics everywhere, okay? Even in the reception area, we cover them with plastic to protect our receptionists from possible COVID patients. Plastic containers, even this aerosol box, it's also made of plastics. And in some posts I've seen, they use cling wrap para daw madaling tanggalin, palitan uli. Di na kailangan pa ng mga disinfect, etc. Okay, so that poses a lot of problem. Now, the Asian Development Bank, in their bulletin that they issued, they said that recycling activity should be avoided at this time. And in the United States, recycling plants have shut down. Yes. And Some countries are suggesting this. All municipal waste should be treated as non-recyclable and disposed of through incineration or sanitary landfill. So again, we have that big problem. What about the plastic waste? Because plastics takes forever to disintegrate and they can cause land and water pollution. We might be protecting ourselves, but we forget about the environment and the community. In hospitals, why is this too much concern about plastics, infectious waste? Because this is how plastic waste or infectious waste are treated. So we place them in a yellow container, we place them in the garbage holding areas. If it's a hospital, they have technologies to disinfect the waste or treat the waste. And usually it's non-burn technology, and then they're discarded as regular waste. They're collected by the municipal collection system or the city collection system, and they are placed in landfills. If there's plastic there, it will take forever to biodegrade or disintegrate. So that's a big problem with plastic waste. And this is now happening in Hong Kong, where coronavirus plastic waste is polluting the environment. Okay, because people there throw their mask and gloves haphazardly. Well, in Manila, wala pa siguro tayong nakikita, but what's scary is maybe 1 week after the ECQ is lifted, baka marami na rin tayong makitang ganyan sa Manila Bay.
Those are face masks.
These are face masks that's been thrown haphazardly by people there. So another problem or another question that has been asked by some is, do we need to disinfect infectious waste prior to disposal? Well, again, going back to that infographics and that article written by Healthcare Without Harm, the best course can be to take advantage of the fact that the virus is not very long lived outside the body. And the best evidence is that it can last up to 3 days on hard surfaces. That's 72 hours. Kaya again, the suggestion that kung hindi araw-araw yung pagkolekta ng basura, wait 72 hours before bringing it out for collection, because in theory or theoretically, patay na yung COVID virus by then. And even the Public Health of England advises that it should be left for 72 hours before sending for disposal as usual municipal waste. Faye and I have been talking about this, and ang problem, alam ba to ng basurero? Because if hindi niya alam, baka hindi niya kunin yon. And that's a big problem for standalone clinics that are in residential areas. So Ms. Faye is going to discuss that in her lecture later. Okay, so just to share with you the infographics that Healthcare Without Harm made. This is downloadable online. So there. Okay, it's not so different from what I've been mentioning earlier. And just a week ago, ito galing na rin sa government natin, the Environmental Management Bureau, you can look for it in this website. They have a waste segregation advisory for household waste. They have these infographics, the same compostable, recyclable, non-recyclable, special waste. Kasama na dito yung mga UV lights na papalitan natin, kasama siya sa special waste, mga bumbilya ng mga UV lights natin. And they have this added category, the special waste or household healthcare waste, particularly disposable masks, gloves, as well as tissues and any other waste used by PUIs and PUMs. For clinics in hospitals, hindi masyadong problema yung disposal because they're under the hospital waste management system. For clinics in malls and buildings, if your building waste management officer is good, hindi rin dapat magiging problema yon. Okay? But the big problem is for standalone dental clinics in residential areas who collects their waste, usually yung LGU, and malamang kasama kayo dito. So if available, dapat available, we dispose of our healthcare waste, infectious waste, in a yellow bag labeled with, again, infected waste, and with the international symbol for biohazards. And this is something different, no? The EMB recommendation: disinfect, use masks and gloves before disposal to reduce the risk of contamination, especially to our waste collectors. And they recommend soaking the mask or gloves for 30 minutes in a diluted bleach solution. So there are many ways to go about it. You wait for 72 hours, which I don't think the waste collectors know. After 72 hours, patay na yung COVID virus. Or you can soak them for 30 minutes in diluted bleach solution, or you can spray the bag with sodium hypochlorite. For chemical disinfectants, we're using a lot of chemical disinfectants now, so it's important to know how they're going to be disposed, how to dispose of them properly. Some of the suggested chemical disinfectants are the glutaraldehydes. An example is Sidex. It's a high-level disinfectant. Ibig sabihin, malakas talaga siya. But the downside of this is that it releases noxious vapors, which can be harmful to our health. They are considered hazardous waste, so we have to contact the waste treater or waste contractor. But in the meantime, we have to store them in bottles, well sealed. Sodium hypochlorite, again, the suggestion is to store them in a suitable container, preferably bottles. And having said that, huwag tayo magtimpla ng sobra-sobra. Kasi pag sobra, magiging basura yon. Because everything, you should be mixing a fresh batch of sodium hypochlorite solution to disinfect our clinics. So mix what is only necessary. As for alcohol, ethanol, or ethyl alcohol, there are some who say you can dispose it down the drain, but others also say, other MSDS also say that you have to store them in suitable containers, the waste. Okay, hydrogen peroxide is no problem, as you can simply throw it down the drain. Now for disinfectant wipes, they go into the garbage bins. Do not flush them down the toilet because they will clog your plumbing system. An important thing here is if you're going to have several bottles of chemical waste, do not mix acids and organic waste together because they can spontaneously combust and cause fires, accidental fires. Okay, now talking about radiographic waste, we're not going to dwell too much on this, except that there's the hazardous waste here, there's lead foil, and it should be segregated and sent to recycling companies. For radiographic waste, we know that used developer solution is thrown down the drain, while used fixer solution is hazardous as it contains silver. They should be stored in special containers for recycling. Do we need to talk about mercury waste? We all know this, and hopefully at this time, wala munang magtatanggal ng amalgam restorations na sound needlessly. That's the least of our concern right now. Okay. Now, dental waste, old crowns, we disinfect them, store them in a suitable container for recycling. All the study casts, for dental laboratories that they have a lot of these old study casts, it's made of gypsum. And gypsum, when landfilled, releases hydrogen sulfide gas, which is both toxic and malodorous. But for us, na mga dental clinics, na konti lang naman, some publications are saying we can just put them in the non-recyclable waste bin. For impressions, we disinfect them and throw it in the general waste bin. So this is the hierarchy for waste management, healthcare waste management. The most preferred will be to reduce, followed by reuse, recycle, recovery, and this is what we don't like, the landfills. This is the least preferred. So for now, we can only reduce. Reuse, there are some. That's, hindi naman talaga pwedeng i-reuse because kalaban natin infection eh. For now, recycling is wala mga nagre-recycle sa ngayon, but hopefully in the future, meron. And of course, there will be some ways na mapupunta sa landfill. That's unavoidable. So our best weapon is to reduce. And how do we do that? So these are some or most of the ways that lahat tayo pare-pareho magge-generate ng ganitong waste when we go back to our dental clinics. How do we reduce them? These ones, I see in Facebook, mga dentists naglalagay ng plastics everywhere. Draping, plastic drapings, thinking that it will protect them. Of course, it will protect them, but my question is, ipupunasan nyo naman yan ng disinfectant eh. And the virus is easy to kill. So, we can do away with it, I think. With this, I think. Now, even this one, diba? Sometimes, kahit punasan mo yan, syempre may mga pasyente, ay gusto ko, meron akong barrier. So instead of using plastics, why not use barriers like this, which is reusable and you can wash. And so you can do away with the cling wrap. Next is face shields. Instead of using disposable face shields, which anyway, hindi naman ganun kaganda because pwedeng masira, why not invest in a good reusable face shield? And even these aerosol boxes, personally, I don't like them because it gives me the feeling na yung pasyente parang nasa kabaong. Okay? So, I would rather, and this one is a cling wrap, manipis na plastic, so that means to say, papalitan mo siya every time na magpasyente ka instead of just disinfecting it. So, why don't we use something like this? A plexiglass that you can just disinfect. It's easy to clean. You reduce plastic waste. And instead of using disposable surgical gowns, why not use reusable gowns? And even this, the high volume evacuator, some of you might not agree, ay, pasip-sip eh. So, ang hirap linisin. But then we can disinfect them in chemical sterilizers. And I'm not saying that we use this, but we can use, oh, sorry, dito muna tayo. Okay, I'll go back. These paper cups. No, I was talking to Mr. Von Hernandez, a plastics expert, and we've been talking na yung mga disposable, parang security blanket natin yan eh, na malinis pag disposable. But these paper cups are actually hidden plastics because they are lined by a plastic lining. They're plastics. They're not biodegradable. So why not use stainless steel cups and autoclave them? Okay? Pareho lang yan ng mga basic instruments natin that we are autoclaving. Okay? And this one, the high volume evacuators, the tips, they're made of plastics, but there are or metal tips that we can autoclave. Okay? That way we can do away with another plastic waste. So if we do substitutions, then take that away, we take this away, this one, this one, this one, and this one. We'll be left with only this. That for now, medyo mahirap tanggalin sa waste side. So we are actually reducing our waste by more than 50%. And I think that's the end of my lecture. We have segregated our waste, placed them in appropriate containers, sealed, stored, what's next? And this is the topic of my partner, Ms. Faye Ferrer. So she will be discussing this. Who collects the waste, how we store our waste when they are not yet collected. She'll be talking about laws and legislations and what happens to the waste after they are collected. And with that, I thank you. And I would like to introduce to you our next speaker. I have been working with her since 2005. We began with the amalgam waste, and from there on, lumaki na ng lumaki. And she has published several articles and full kits, the last of which is about plastics in healthcare. And she is a consultant of the USAID MTAPS program on healthcare waste management currently. And she's also a consultant of the Department of Health response to COVID-19 pandemic in healthcare waste management. She has more than 15 years of experience on environmental health management campaign and program development. Please welcome Ms. Faye Ferrer.
Hello. Thank you so much, Doc Michelle. Hi, ako po si Faye, pero I would need to close my video kasi medyo may lag time. Kaya balik na lang po ako kapag question and answer portion na po. Okay, so I hope you can hear me. So again, thank you so much for that presentation. I think Dr. Michelle Segarra has given you a good idea in terms of the waste that your clinic, regardless of its setting, would be accumulating. So let me just go through this one. And I think there are several questions already popping up. So, wait. So going, this is again, a supplemental presentation of what Doc Michelle has given you. So let me go back to the questions that have been raised. What's next? Who collects the wastes? Are there laws that covers the wastes generated by dental clinics? For purposes of this presentation, dental clinics would be a general term, regardless if you're set in a hospital, in a mall, or standalone. So those are dental clinics. And what happens to the wastes after they are collected? Does it make sense to segregate wastes? Okay, so again, just to give you a briefer, again, like what Dr. Michelle has given you, healthcare waste is defined as wastes originating from minor or scattered sources. That would include hospitals, healthcare clinics, healthcare facilities, and dental clinics. Again, do not think that your clinic, regardless of your setting, hospital, malls, standalone, you are dental clinics and you are a healthcare waste generator. Your waste are considered healthcare waste if it's used for diagnosis, treatment, and management. Again, as I mentioned earlier, these are the sources of waste, of healthcare waste, and dental clinics is part of those. So just again to review on the types of waste or the categories of waste, in the Philippines, there are different types of waste, but they are generally defined or categorized into two. One is the non-hazardous, or more famously known as general waste. It is defined as it has no potential to cause harm to the individual when exposed to it. It is neither infectious nor potentially toxic to the body. It accounts for 85% of the total waste generated with the healthcare setting. Again, even in a dental clinic setting, this statistics does hold true. And the other category is hazardous or infectious waste. This one has the potential to cause harm if an individual gets exposed to it. It accounts to about 10 to 15% of all wastes generated in a healthcare setting. Such waste is either infectious or potentially toxic to the body, and about 1% of hazardous waste are considered sharps waste. So as the UNICEF, the USAID, even the Department of Health This is the minimum requirement for those that are handling wastes in a healthcare, again, regardless of the size, even a dental clinic. This is the minimal requirement. Again, the Philippine Dental Association may provide a different set of PPEs for cleaners and handlers, but as per DOH recommendation, you would need medical mask, goggles, or face shield, especially if risk of splash from organic materials or chemicals is high, apron, long sleeve gown, thick heavy duty gloves, boots, or closed work shoes. So healthcare waste systems, even if you are a small dental clinic, you need a waste management officer. It may not be titled as an officer, but you need one person who knows about waste handling in your clinic setup. Always remember that infectious and general wastes must not be mixed. Staff, regardless if you're the dentist, you're an assistant, you're the receptionist, you all must be trained on the risk and safety procedures of handling wastes. You need appropriate labels, signs, segregation system on your establishment. And you need to register. This one is very contentious to many dental clinics, but as part of the manual that is provided by the Department of Health, you need to register as a waste generator with the Environmental Management Bureau of the Department of Environment and Natural Resources. So for the question, who collects waste? So who collects waste for hospital-based clinics? Fortunately, most hospitals would have third-party treaters or TSD, treatment, storage, and disposal companies. Some hospitals have their own on-site treaters, like the example of Dr. Michelle Segara, the hospital in Iloilo of St. Paul. They have their own autoclave system, so they can treat it on-site. Who collects for mall-based or building-based clinics? Most of them would be, again, TSDs, third-party treaters, or the LGU. And who collects for residential areas? That would be LGUs or third-party treaters as well. Some of the dental clinics within the vicinity where I live do have some third-party treaters that they are connected with. So just to give you an idea of what are TSDs? TSDs are treatment, storage, and disposal companies. They must conform to the rules and regulation mandated by the Environmental Management Bureau, and they are listed as registered treatment, storage, and disposal facilities at the the EMB, Environmental Management Bureau website. It's highlighted here because you can just click this and it will divert you to the EMB website. The category for infectious waste under the Environmental Management Bureau is M501. So are there laws that covers waste generated by dental clinics? Again, by very definition, as waste generator, you are covered under Philippine laws to follow the following. So there are several laws, memos pertaining to dental waste. The most urgent one is the Department of Health Department Memorandum 2020-0157, released last April 2. It is the guidelines in cleaning and disinfection in various settings as an infection prevention and control measure against COVID-19. First, you need to use sodium hypochlorite solutions for disinfection of surfaces, disposed PPEs, and similar healthcare wastes. Use of other type of disinfectants such as ammonium chloride, phenols, and hydrogen peroxide are also allowed. Use of appropriate PPEs for waste disinfection is important, and practice proper hygiene. This is one important thing that all dental clinics should follow. Practice proper hand hygiene. This is, I think, one of the most important thing that any clinic that needs to set up as well. Another memo that you need to follow through is the Department of Health Department Memorandum 2020-0170, or the interim guideline on the management of healthcare waste in health facilities. community quarantine units, and temporary treatment and monitoring facilities with cases of coronavirus disease 2019 or COVID-19. This is categorizing all wastes of suspect, probable, and confirmed COVID-19 patients as infectious waste. As you will recall, suspect, probable were the former PUIs and PUMs definition, but they were already stricken out of the lingo of pertaining to COVID-19. So they are using suspect, probable, and then confirmed COVID-19 patients. Again, it reiterates the use of personal protective equipments when handling infectious wastes. Storage for infectious waste, as per the department memo, would be 48 hours or 2 days for cold season and 24 hours only during the hot season, which is currently the season that we are in. The Environmental Management Bureau as well has released Memorandum Circular 2020 number 15, which is an addendum to the interim guidelines on issuance of special permit to transport. This special permit to transport was released by the EMB because of the lockdown happening in the Luzon area, wherein a lot of hospitals and even some of the clinics that are open were having problems in terms of the collection of their infectious wastes. So the EMB has released this memo to give permits, special permits to these third-party treaters to be able to transport and pick up the infectious wastes of those needing collection. Again, as a reminder, M501 is the code for infectious waste for all infectious wastes generated by healthcare and even dental clinics. And there is also the Joint DNR-DOH Administrative Order 2005 number 2, which is the policies and guidelines on effective and proper handling, collection, transport, treatment, storage, and disposal of healthcare wastes. This particular joint AO defines the jurisdiction, authority, and responsibilities of the DNR and DOH with regards to healthcare waste management. This is very important because before this joint AO, although it's very dated, it's been drafted in 2005. It clearly defines that if a waste is generated inside your facility or your dental clinic, it is an issue of the Department of Health. But once it goes out of your clinic, it is the jurisdiction of the Department of Environment and Natural Resources. The Joint AO also provides guidelines to generators on handling, collection, transport, treatment, storage, and disposal of wastes. And this is applied to all healthcare waste generators, including owners and operators of the TSDs and final disposal facilities. Another one is DOH AO 2007-0014, which is the guidelines on the issuance of certificate of product registration for equipment or devices used for treating sharps, pathological, and infectious wastes. This would include generators of healthcare waste that use equipment and devices in treating sharps and infectious wastes. They should be able to apply for certificate of product registration. I am assuming that most of you would have your own instrument disinfection system. You have already applied for this type of certificate, and it must be an approved technology that may be used for treatment of sharps and disinfection technologies. Another one, and another important one, is Republic Act 9003, or the Ecological Solid Waste Management Act. It requires segregation of solid waste at source, including dental clinics, by using separate container for each type of wastes from all sources. It has, Dr. Michelle Segara has already defined to you the proper segregation of wastes. Collection and transport of segregated general waste or the non-infectious waste are covered by RA 9003 and disposed to landfill for disposal. Just to be clear, those that you generate in your black bag are the ones that are the responsibilities of RA 9003 and is being followed by your LGUs, your local government units. So infectious waste that are generated, which is your yellow bag, is under Republic Act 6969, which is the Toxic Substances and Hazardous and Nuclear Wastes Act of 1990. Infectious waste, but again, it has to be clear, infectious waste, once treated, is infected, may be treated similar to general waste. Although this one has already been superseded by the interim guidelines released by the DOH. So again, one of the questions is what's next? What happens to the waste after they are collected? For collection, treatment, and disposal of waste, for offsite collection, the TST group companies are required to have proper packaging when they are collecting your waste. So you've already done your job. You've already placed it in a proper yellow bin, yellow liner. Double bagging it is okay, but if you know that it would be picked up immediately by your third-party company, please do not double bag it. It's a waste of money already. Label it, as Dr. Segarra has mentioned. Labeling it not only gives you an appropriate idea when you have generated it, it is also important for the TST to know the type of waste that they are taking from you. So for offsite transport, that means they're collecting it and they're transferring it to their facility. They must be compliant as well to RA 6969, and they should be accredited service providers and transporters by EMB-DNR. Again, the link for that is in one of the slides that I mentioned earlier. And after treatment, these wastes are disposed in a special chamber in a sanitary landfill. For offsite treatment and disposal, they are accepted treatment and disinfection technology are already listed in the DOH Healthcare Waste Management Manual. The DOH, for your information, also Doc Michelle, has already released the 2020 fourth edition Department of Health Healthcare Waste Management Manual. Again, what Doc Michelle has mentioned earlier still holds true because it's still part of the fourth edition. Sanitary landfill is an accepted one, not the open dump sites. On-site treatment and disposal, again, accepted treatment and disinfection technology, and LGUs are the one collecting it. So does it make sense to segregate the wastes? Of course it does. Segregation is a must. Regardless of a pandemic or whatever emergency we have, segregation does not only help you keep everyone safe, it also helps you not to be caught by either DENR or DOH for violating the laws. So what you need to do is you need to have appropriate labels and signs for your plastic bags and your waste bins, and posters showing the type of wastes must be placed near the bins. Appropriate waste receptacles, plastic bags and liners, bins, and sharps containers should be available for use by your clinic. As you can see in the photo, pedal type of waste bins is encouraged because you lessen the contact on the waste bins. 3 waste bins and sharps containers must be collected when they are 3/4 full and must be properly sealed prior to disposal or transport. The only downside of the swan type sealing is that if there is an accidental throwing of sharps in that particular liner, that is a risk for that person handling that waste. So I think there are a more effective way of sealing that bag, but on my personal experience, I do not recommend it. So that's the presentation, but we have to note this particular one. It's important to remember that one, dental clinics are sources of both general and infectious waste. dental clinics should follow proper segregation of wastes, should be able to learn about different laws and memorandums, and dental clinics are faced with the dilemma of increased infectious waste. So what's next? Dental clinics, through their regional, national chapters, should be able to discuss and implement effective and compliant waste management system. And dental clinics must plan on how they can safely disinfect and dispose infectious wastes. So with that, thank you, and I hope I have shared to you some good ideas on the laws pertaining to healthcare wastes. Thank you so much.
How long do we wait before the next patient is treated?
Well, if you're not using the UV light, which will require you to wait for at least 30 minutes to 1 hour, and after you wipe it with sodium hypochlorite and hydrogen peroxide for 5 or 10 minutes, give it some time para mawala yung amoy, then you can treat your patients already, the next patient already. Maybe,
Ma'am,
yeah.
sorry, ma'am, the wait period po? The wait period is?
The wait period is, I cannot tell you exactly na dapat 30 minutes or what, but the ADI states that sa kanilang bagong guidelines, the ADA is you allot 30 minutes per patient in the clinic.
Okay. Next question.
Yeah.
Next question na. Sorry. I have been using the reusable, sterilizable stainless metal cups and cloth bibs for a year already. It has reduced our waste in the clinic and lessened our expenses as well. So this is just a comment. It's not a question. And another one, do we consider dental laboratory waste as healthcare wastes and therefore should follow the same protocols as the clinics?
Yes. Dental laboratories are also waste generators.
Okay, thank you, Ms. Faye. Other questions here with me, Dr. Armin. Who will collect the trash now and how will they dispose of it? I suppose that's the question.
Naku. Yun nga yung contentious doon eh. Again, this is up for debate. But then again, if you are, again, general wisdom na lang to. If you are so used before that you can throw your waste through the LGUs, which is before if before it is acceptable, you have to be mindful now that many waste workers, especially from the LGU level, will be very cautious into taking your wastes, especially if they see it in a yellow bag. Although it's also dangerous if you place your infectious waste in a black bag and they, however, find out that it is infectious waste and they'll be able to trace it back to you, then that would be a problem for your clinic. So again, if you're hospital-based, you're good, you're safe. If you are building-based, you need to talk to your building administrator about it. If you are a standalone clinic, you need, again, this is my recommendation, this is a personal recommendation, which I have been advocating for many years now. You need to connect with every standalone clinics within your vicinity to be able to talk to a TSD that can take your infectious waste, because volume of waste is important for any TSDs. So if you are able to talk to a lot of standalone clinics within your area, then they may be able to pick up your wastes.
Thank you, Ms. Faye. Ms. Faye, to add to that, since our harmful waste collector is out during this pandemic, how will I store my harmful wastes or dispose of them properly on their own, I suppose?
Mm-hmm. So we're assuming that your clinic is open during this lockdown. If you are and you already have infectious waste, your treaters should be able to collect it because they have special permits for that. It's not a problem. You need just to call them and they would be able to collect it. If they are not collecting it, that means you need to find a safe place to lock it first, and then have it pick up when the lockdown is lifted.
I suppose, ma'am, that's connected to one question here. Ang Las Piñas chapter daw is still in the process of dealing with the hauler. For the time being, how do they do it? How do they keep
Okay.
or dispose of medical waste?
Good thing meron na silang kinakausap. Yun na nga, again, it depends on, yun. So, I think the volume is not that huge in terms of volume, it's not that huge. So if you can find a place where to store it, that's better. But if you have waste that are sort of organic in nature, like we don't have naman body tissues there. So I think you can store it properly. And then just for purposes of, because you're storing it, you can spray it with sodium hypochlorite.
Ma'am, I suppose yung sinasabi organic would be the pathological tissues. Yung mga like,
yes.
So
If
that one also that way.
Kung may pathological wastes, yan ang medyo issue kasi una, mag-aamoy yan. Pero kung if it's not pathological in nature, you can store it. If it's pathological in nature, that's a problem, and then that would necessitate fast tracking the talk with your treater. Wala akong iba kasi you cannot give it to your LGUs
in the meantime. Ma'am, I think it's also a question. I think it's handled also by Dr. Michelle, no? But maybe you can answer it also. One is curious, how many hours would the virus stay if it's in our waste, like cotton, gauze, bib, gloves? Siguro yung concern nila if this will not be hauled, how long should it stay like that?
Again, yung sinasabi nga dito, as Doc Michelle has mentioned, dahil masyado siyang napaka-unique nito at ang bilis niyang ma-decontaminate, hindi na to dapat ganun ang usapin. Once nasa bag na siya, yellow bag, you just have to seal it and then pabayaan nyo, dahil it should never be opened again. I think that your concern should not be how long it will last. Once you've sealed the bag naman kasi, that means that's it. You will not be contaminated by the waste because you've already sealed it, because you don't want to open it again. So again, beside the point yung question ng gaano maglalast, kasi automatic naman kayo you put it in the yellow bin. If it's already full, almost full, you seal it. So yun lang, dapat it is not to be opened again. I think that has to be very clear.
Thank you. Ma'am, I think this is also for Dr. Michelle. So clarification now. To clarify, when do we double bag the hazardous waste again? And when do we spray it with disinfectant? So maybe a distinction or a clarification from the two.
Okay. If it's infectious waste, it is recommended that it be double bagged. And for the sake and safety of everyone, we disinfect it with disinfectant spray.
Twice, you double bag and then you also spray it.
Yes. Kasi going to stay there in your clinic from morning to evening for the safety of everyone. As an added precaution, spray na rin natin.
Spray. And ma'am, the other question was, can we use concentrated Lysol diluted with water as a disinfectant? Oh, we're promoting but they asked about Lysol. So
I've read about
Lysol dyan.
Ako muna, Faye.
Okay, Doc.
I've read about it sa EPA website, the Environmental Protection Agency. It's one of the disinfectants that they are recommending.
So we can use that.
Apparently, yes, according to the EPA.
Okay. Ma'am, the question is a little more timely now. Ito naman, let's go to the PPEs. Now that here, how can we lessen waste, especially with all those additional PPEs and infection control measures in the next, the new normal, the next coming months that we're going back to practice?
Yes, the PPEs will be part of our lives now, undeniably. Ganun na talaga. So as I've mentioned in my lecture, let's look at reduce. Okay? Less disposables kung pwede. As I've shown in the last slide, instead of using disposables, may mga bagay-bagay na pwede namang hindi disposable. Okay? Like yung mga cling wraps. Huwag na tayo mag-cling wrap. Instead, pwede naman natin i-disinfect. Diba?
Okay.
Kasi kung minsan, nagiging security blanket natin yung plastic eh. Kung may plastic, malinis. Pero, hindi disinfect naman natin yon. Remember, the virus is easy to kill outside the body. So this is what WHO WHO considers or referred to as sensible use of PPEs. Kasi kung minsan, pardon my saying, overkill or OA eh. Nag-disinfect ka na, lalagyan mo pa ng plastic, may problema ka na ngayon sa waste. Diba? Or, ano pang mga example, ayaw mo ng, gusto mo lagi disposable, yung iyong surgical gown, para bawas trabaho na, you can use reusable gowns, okay, na washable. So things like that, I think we have to reassess and rethink. Okay, what are the things that we can reduce and reuse to minimize waste? Because they're predicting, I saw a paper from ADB, toneladang waste ang maproproduce Manila alone, okay, from healthcare waste. Eh wala pa raw tayo sa pinaka-peak. Pag nag-open pa after the ECQ, dadami yan. So, we have to reassess. We have to rethink. Paano nga ba natin babawasan? So, if there are ways that we can reduce it at hindi lahat disposable, mga plastics, bawasan. Because hindi lang tayo ang gumagamit ng plastics. Even the food industry, puro plastic na ang ginagamit. This will be a plastic world for the next few years because of COVID.
Okay. Ma'am, in relation to that, so there's a question and comment here by Dr. Escoto. For reusable PPEs like gowns, and if you autoclave them and disinfect first the laundry or just laundry and segregate them from the clothes, is that enough?
Yes, because the virus is easily killed by water and soap. So much more detergent. If there's a space in your dental clinic, maglagay kayo ng washing machine. Doon yun na, hugasan or labhan. Lahat ng mga PPEs.
So they bag it. Yeah, but they bag it, they bring it home. Correct?
Yes, they bag it. Yeah. Even for, just as an aside, even for masks na ginagamit ng public, because there's this tendency, pag disposable, tinatapon na lang sa basurahan. These are infectious waste pa rin. So you have to remove it, fold it, with the inside part, yung infected part na sa loob, i-fold nyo and then roll it. And if possible, i-bag nyo rin before throwing it in the trash can.
Okay. So ma'am, speaking, related to that, if we soak the gloves, saliva ejectors with 1% sodium hypochlorite for 30 minutes after use, will it be non-hazardous waste already?
Pwede na. Theoretically, pwede na. Kasi patay na yung bacteria eh.
Okay, not to, of course, just to throw it also again.
Just to throw it also again.
It becomes general waste.
It becomes general waste. Pero nga, theoretically, ganyan yan. Pero pag nakita yan, ay, infectious waste yan. Kukunin kaya yan.
Okay. Ma'am, here's another question. For both, no? Let me just go through it. If, we answered that already. How do you propose to handle reusable gowns? Disinfection under law. That we're done with that. On our next question that was asked beforehand. Here though, ma'am. Spraying on infectious waste inside the yellow bag, not for aerosol, which we are trying to minimize. Aerosol spraying to disinfect plus puts the handler at risk. I suppose he's just verifying if it will put the handler at risk.
Yes, that's why the handlers, dun sa lecture ni Miss Faye, talagang naka-PPE din siya. The one handling the waste should be wearing PPE.
So, yan yung sabi niya. When you spray the aerosol, the disinfectant, you're also putting that person at risk, correct?
Yes. So, meron pa rin dapat siyang PPE.
Okay.
Hindi. You mean to say, bago niya itali, i-sprayan niya?
Yes. Spraying the infectious waste inside the yellow bag, not for aerosol. Yun.
No. No, you don't know. You don't need to do that.
You don't need to do that. Yeah.
Okay, that is a question. So, ma'am, now we go further. How can our local LGU help us in our waste disposal for used PPEs? Yan na.
Yun na.
Ms. If you want to answer.
Sandali lang ah. Okay. Ganito yan eh. I think ito yung urgency on the part of the dental industry, lalo na yung sa mga standalone clinics. Kasi ano siya, kung dati hindi siya felt, nga again, I'm reiterating this, if ito ay hindi felt before, I think the urgency is now. Before, I highly suggest, before this lockdown ends, your chapters or your national association should be able to talk to LGUs or even the IATF in order to be able to secure a more viable way that your wastes are going to be picked up. Kasi even ako on a personal level, LGUs can pick up your infectious waste. However, since in terms of delineation, they are not allowed to do that. But if it's already disinfected, and if you can attest that it's already disinfected, they should not refuse to pick it up. But then again, you run the risk of infecting the waste handlers if you say that you've disinfected it, but have not really disinfected it. So it's a two-way street. You have to be very honest, you've disinfected it, so that LGU will accept it. Or you, again, the most important thing, you go to a TSD. Again, ang laki ng dilemma ng dental talaga dito. Yun yung ano.
Speaking of honesty, ma'am, sabi niyo, we have to be honest.
Yeah.
Is there a government agency that will check if proper disposal and infection control protocols are adhered to?
Meron.
I think the person wants to know, yes.
The DOH and the DNR.
Sorry, ma'am?
Sorry, it's the DOH and both the DOH and DNR.
Okay. So those are the agencies that they can report to, if ever.
Yes.
Also, speak of the DENR. Someone was asking, after this seminar and following the key points that we got from this this webinar, can we actually be considered DENR compliant if we follow both your advice?
Yes, definitely. I mean, again, una kasi you have to be registered as waste generator. Ano yan eh, even before you set up your clinic, those are one of the permits that you need to acquire. Again, if you do not have that, that means the DNR has been very lax in their job of looking into your wastes. But then again, in these special circumstances, I think the DNR would be very hard on your clinics. I mean, I am foreseeing that. So you have to be very careful.
Now, standalone clinics, so ma'am?
Standalone clinics, yes.
If I may add, yung question ba na yan is about, because before COVID, maybe last year, there was this memorandum that we have to attend a seminar given by DENR. Yung ba yung sinasabi sa question na yan? If this will take the place of that seminar, Rochelle?
This was even before. This was a pre-question. Sorry.
Yeah. Kasi di ba, there was a time that they required dentists to attend seminars given by DNR. So, I don't know if included to sa mga ganung seminars. But
it's different times.
yeah, it's different time eh.
Different time, yeah.
Paano naman sila magbibigay ng seminars?
Mhm.
Also, if I may follow up on the TSDs, one of my friends, sabi niya, she attended a seminar and then PDA issued this memorandum na yun nga, may mga mag-check na DNR and the EMB sa mga
Ayun.
clinics.
Mhm.
But the seminar was stopped. The memorandum na hold. Why? Because when the PDA talked with dentists and they did some talks, and what they realized is yung mga TSDs, they will not collect the waste because sobrang konti yung volume. Kasi talo sila ron. Sanay sila sa mga hospital na maramihan eh. But sa mga dental clinics, kung pa konti-konti, paano yon? Kulang daw tayo sa volume. Kaya ang laki ng problema. So what some chapters did, I think, is that gumawa sila ng program na the members will pay a certain amount so that at a given day of the week or month, dadalhin nila yung kanilang waste doon or may iikot na kukolekta para ma-reach yung given volume na gusto nila.
Ma'am, but you're talking about it's pre-COVID. That arrangement.
But now, dumami na. Mm.
Okay. So will it be, will there be more?
Definitely.
This is, I think, for Dr. Michelle. Instead of the disposable gowns, will it be enough to use a reusable surgical gown, but to be changed every patient? Before rewashing, do we still have to wait 2 to 3 days to make sure that the virus has dissipated?
Okay. If you wash it, wala na yung virus. The virus is killed by soap and by detergent and water. So you have to change it after every patient. So if you have, you will have 5 surgical gowns.
Okay. There's another question that's related to that. What if water repellent daw yung gown, and then you just spray it with alcohol, wait a while, and then treat the next patient? There was one here that message.
The problem there is, what if there's debris?
It has to be tested.
If there's an organic waste, nakadikit doon. Kung minsan yung mga disinfectants, hindi tumatalab pag meron kang mga blood or mga organic debris.
Wash it out, though, I suppose.
Yeah, you have to wash it out first before you can spray it. And kung meron ng mga blood spills and saliva stains, do you think the patient will be comfortable seeing you treating them in that gown? Especially now, patients will be very finicky. Bago po ba yung mga gown nyo, Doc? They will say things like that. They will ask things like that because we are protecting ourselves, but they are also protecting themselves.
Okay. Ma'am, connection to the PPEs. I think Dr. Michelle will answer this. No? For relatively small clinics, how do you observe safety measures to follow during disposal of PPE doffing area, and then I suppose when you're donning and doffing, and then the disposal of the biohazardous? We answered that already. But I suppose more on the donning and doffing, pag maliit daw yung clinic mo.
Well, wala tayong choice. Kailangan mag-provide tayo ng donning and doffing area eh.
Okay. So, there's a makeshift.
Yeah. Diba yung mga fitting rooms ng mga malls, mga department stores, yung ganun lang kaliit. Okay, and then you have there sa doffing area, waste bin for your waste, for your doffing waste.
Okay. Ma'am, one last question here. I'm taking one more. What is better to use as a disinfecting countertop I suppose, for the countertops. Sodium hypochlorite or diluted Lysol. Nako, we're promoting, ano, no? We're promoting products here.
Yeah, you know, in literature, in guidelines, CDC, ADA, WHO, yung talagang laging nakikita is the sodium hypochlorite. So if you'll ask me, I'll go with that.
It's cheaper pa.
Mm.
If there are no more questions, okay, this one here, one last now. One question. Okay. So if there are questions here, we'd like to announce to everybody, if you do have questions that you were not able to put in the chat, you were not able to think about it, just now, can you please send it to the updaa@gmail.com, and we will make sure to forward it to Ms. Faye and Dr. Michelle. Okay? So,
Dr. Rochelle,
yes.
may pahabol lang po ako. Nilagay ko po sa chat box yung EPA approved disinfectant for use sa COVID-19. Ang dami niyan. So you can go through the list. Hindi lang, wag natin masyadong payamanin ng Lysol. Marami po na check available sa inyong dito sa Pilipinas. So just go through that link at maganda yan. Yun lang po.
You send the link to everybody, no? But for those who are not able to avail of this link, what we'll do, if you answer the survey forms that we will send you, we will send you that link. So para with those who are watching us. So with that, sir, Dr. Armin.
So I think without further ado, we'd like to thank our audience for being a good audience, listening to our two speakers. Thank you to our resource speakers. Ang laki na kanilang honorarium po. They got a virtual honorarium today amounting to 1 million pesos times 0. And also to our hardworking people in the background, headed by Jonathan, and our pool of question collectors and moderators for questions. Thank you so much sa tulong yung lahat. And to also UPCD, UP College of Dentistry. And I guess to end it all, before we end our meeting, we want to play a song. Back to our director. So goodbye everyone, and thank you so much again. Rochelle, back to you.
Okay, we would like to thank again, we mentioned, the moderators and the technical team. Again, we would say Dr. Michael Mendez, Dr. Elch Barroso, Dr. Monica Sison Rivera, and of course, under the technical direction of Dr. Jonathan Panyalan. Thank you. And thank you, ADI fellows. Thank you, UPCD faculty and UPDAA alumni. And to the Filipino dentists who are saving lives but choosing to stay home, thank you. And from the bottom of our hearts, we say thank you. And mula po sa mga tahanan naming mga dentista para sa bayan, salamat po, and we will leave you with our university hymn. Thank you.